wellness revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to the program. Today we're going to discuss a very commonly requested online subject, and that's the question about tubal ligations. Now, tubal ligation is where a woman's fallopian tubes, which carry the egg from the ovaries to the uterus, those fallopian tubes are tied off. That's a tubal ligation. They're ligated. They're done with either clamps or they're cauterized, and that prevents the egg from being able to be transported through the fallopian tubes into the uterus. And of course, women do that to prevent pregnancy. It's a very common surgical procedure. Well over 700,000 women every year have tubal ligations performed. So a question to you is, if you've had a tubal ligation, have you had any change in the way you feel? Have you had problems with mood swings, fluid retention? Have you had problems with increased premenstrual symptoms? Have you had problems with irregular periods or heavier periods? Have you had headaches, breast tenderness, mood swings? Have you had hot flashes? Have you felt depressed? Have you had panic attacks, anxiety attacks? Have you had difficulty with weight? All these can be a result of a tubal ligation. Now, you may go to your physician and say, "Doc, I had this tubal ligation, but I've got all these symptoms now. Could it be caused by that?" And he'll go, "No, it didn't cause it. That one doesn't have any effect on you at all." Well, of course it has an effect. When your ovaries, which are on either side of the uterus, you have two ovaries, and the ovaries have blood supplies. There's two arteries that go to the ovaries, one the ovarian artery and then a uterine artery. So the uterine artery runs along the fallopian tube. And when you tie that off or cauterize it or clamp it, it shuts off the blood supply from the uterine artery to the ovary, so it only has the ovarian artery. And that's just not enough in many cases for women to have good function of their ovaries. They don't function as well, so they don't produce the hormones that they need, and all of a sudden they begin to have problems associated with hormonal decline and imbalances. And instead of treating you with antidepressants and anti-anxiety medication and sleep medication, what a doctor ought to do is replenish your hormones naturally using natural bioidentical hormones. And so this is what we recommend. We've treated thousands of women post-tubal ligation who have developed problems, who go to their doctors, they get them on all these different toxic pharmaceutical drugs, which don't resolve the underlying problem of hormonal imbalance. Now, women can have hormonal imbalance many different times during their life. They can have it after a tubal ligation due to the decrease in blood supply to the ovaries when the ovaries don't function well. Normally, within 2 or 3 years, women are going to begin, after a tubal ligation, to experience symptoms of hormonal decline and imbalance. That's very common, and their periods will end earlier, and they'll go into early menopause. So it's after a tubal ligation that we see hormonal imbalances due to poor blood supply to the ovaries, but we also see it in young girls going into puberty have some hormonal imbalances. We see it when women are on birth control pills. That shuts off all the natural hormones and puts in counterfeit hormones into the body, which are the birth control pills, which can cause a host of health problems. And many women just feel terrible on the birth control pills, so we don't recommend that. We also see it after childbirth, hormonal imbalance. We see it after a hysterectomy, and we also see it in menopause when the hormones decline and eventually get shut off in menopause. And so at the Hotze Health and Wellness Center, what we do is we treat women with natural bioidentical hormones. What is a bioidentical hormone? A hormone that is biologically identical to the hormones your ovaries used to make in adequate amounts and balanced in adequate amounts so you felt well. And that's a bioidentical hormone. And so we use natural estrogen, estradiol or estriol. We call it Biest. And we use natural progesterone. and we have to balance those out. Women, as they march through their menstrual life, their hormones will become imbalanced. So it may be after a pregnancy, but it happens by the time they get in their late 30s, early 40s, you begin to have hormonal imbalances, and that's because the ovaries every month don't function as efficiently as they did when you were a young woman. You don't always ovulate every month, and when a woman ovulates in mid-cycle, there's an area of her ovary called the corpus luteum that produces progesterone. That balances out the estrogen. If she doesn't ovulate, then she'll have estrogen dominance, and that'll cause proliferation of tissue in the inner lining of the womb, and the periods will become heavier, and they'll have clotting and bleeding and those sort of things. So what you want to do is make sure that after a tubal ligation, if you're having any symptoms, you want to get back on natural bioidentical hormones to treat your underlying hormonal imbalance, which is caused by the tubal ligation. If you'd like us to partner with you to help you get on a path of health and wellness, then please feel free to contact us at one of our new guest consultants at 281-698-8698. It would be a privilege to partner with you. Our goal for you and every one of our guests is to help get them on a path of health and wellness naturally, so they have energy, vitality, and enthusiasm for life. There's no reason at whatever age you are, you shouldn't have energy and enthusiasm for life. And that's what we want to help you do, produce the energy to feel well. Thanks for joining us today, and please let us know if we can be of service to you in any way.
At Physicians Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. We believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.